Hear us, Dougie?
I'm main camera, yeah.
Do you have that on?
It's right here.
It's already rolling?
30 seconds.
30 seconds.
Thank you.
Really?
You do good work. I have a question.
Questions for later.
So is the advertising Starbucks these days? How are you guys doing?
Well, how are you?
Wearing a mask.
Good afternoon, everyone. Thank you for being here today. I really appreciate it. I want to give you the latest update on where Arizona is around the coronavirus. We've been working on this issue 24/7, and we're going to continue working on this issue. It's been 100 plus days that we've been focused on COVID-19, and we're going to continue to take the actions necessary to protect and promote public health in Arizona. I want to say thank you. I've begun all of these press conferences by saying thank you to the people of Arizona. They've been terrific. They've been great partners in what we've had to do. There's been a lot asked of the citizens of Arizona. There's been a lot of sacrifice. I want to remind people that this is a marathon. It's not a sprint. There is more to do, and there is indication that we are not out of the woods. So I'm saying thank you for everything that's been done, and thank you in advance for what's going to be done. Today I want to take you through our plan of action and show you what's guiding us and what's guiding our decisions. First and foremost, we want people to stay healthy. If you've not contracted COVID-19, you can avoid contracting COVID-19. If you do contract it, we want to be able to care for you, but we're hopeful that you can avoid that. We want to slow and contain the spread. We have successfully slowed the spread of COVID-19 in the past. We're going to successfully slow COVID-19 again. And in our current situation and the challenges that confront us, there are opportunities to contain the spread. And I want to touch on those as well. And then, of course, we want to ensure hospital capacity. This is highly contagious. There is widespread transmission. For people that get ill and need the hospital, we want them to have the skill and the care and comfort of Arizona's finest to nurse them back to health so that they can recover. Today we have hospital capacity, and we intend to keep it that way. Our approach has been calm and steady. We will take urgent action to protect public health. Our timing has been later, and our touch has been lighter around restrictions in the economy, and our emphasis has been on data-informed decisions. Going forward, our information will continue to be acted on with data backing it up. If there were anything that we're going to morph from this, it would be that we will be vigilant constantly as this virus is tough and challenging at every front. We will be flexible as necessary to address this. And we will be humble in terms of what can be done to contain this and slow this. Let's take you through the numbers. You've seen this before. This is the gating criteria provided to all the governors by the White House and Centers for Disease Control. We'll measure symptoms, cases, hospitals, and testing, and show you where Arizona is today. The symptoms, we want to see a downward trajectory of influenza-like illnesses and downward trajectory of COVID-like cases. Blue represents COVID-like illness surveillance. Gold represents influenza-like illness surveillance. You can see at a certain point on the y-axis, we did have several weeks of a downward trajectory that then became flat and has begun to increase. Increasing is the wrong direction. We want lines that are headed in the downward trajectory. Cases. We want to see a downward trajectory of cases within a 14-day period, and we want to see a downward trajectory of tests as a percentage of total tests within a 14-day period. This is COVID-19 cases by day. You can see it from March 9th to our most recent information. I said 2 weeks ago that there was not a trend here. There was just a lot of data and information. On this graph, looking at the last two tranches of data, the last 2 weeks of data, there is a trend. And the trend is headed in the wrong direction. And the actions that we're going to take are intended to change that direction and reverse this trend. We've increased testing in Arizona. You can see in blue, that is the amount of diagnostic or PCR tests. A mountain of testing and increase has taken place. With increased testing, there are increased cases. But we have increased cases in addition to what's been done in testing, and that's the gold line, which shows the level of positivity. You can see we are driving that level down for several weeks in a row, and over the last several weeks, we've seen increasing positivity in the state of Arizona. What we want to see and will see after the actions that we take today is increasing testing, and we will bend that curve back in the downward direction. Hospitals. You want to make sure in this situation that you can treat all patients without crisis care. Here's our hospital beds in Arizona. Gray represents availability. Blue represents inpatient beds in use. If you look at this graph, you can see in gold the inpatient beds used for COVID-19 patients overlaid across it. You can see also that there is a June increase over May in COVID-like beds in Arizona hospitals. Our intensive care unit, if you're extremely sick, this shows you availability in gray and beds in use in blue. If you overlay COVID-19 cases, you can see across this that, again, a slight increase, but it is an increase in intensive care unit beds in June over May. In both intensive care and hospital capacity, we do have capacity, but the increase, the direction, the cases are all concerning. The intensive care unit hospital beds, the gold is ICU beds for COVID-19 patients. You can see this over the course of time since May 15th. Same with ICU beds for non-COVID-19 patients. So slightly flat, but a number that we watch and monitor with great interest every day. And then ventilators. Gray represents availability, blue represents ventilators in use. A ventilator is something someone needs if they're extremely ill with COVID-19. If you look at the COVID-19 ventilators in use, you can see this is pretty much a flat metric with a lot of capacity. Let's talk about testing. We want to have a more robust testing program for our healthcare workers, everybody who needs a test. We're also focused on antibody testing and tracing contacts of COVID-19 results. This is our testing by day in Arizona. We've had a testing blitz that kicked off on April 27th. Over 454,000 tests statewide, 318,000 diagnostic or PCR tests, 136,000 plus serology or antibody tests. Testing is important for a number of reasons. It allows public health to identify cases, and that's what we're going to talk a little bit more about today in terms of containing the spread. Our testing blitz has given us more information, and we're not going to let up on it. Last week, we saw our single highest day of PCR tests reported. On June 9th, we had 14,000 plus tests for that single day. We've also partnered with ASU, and I want to thank Michael Crow and the innovators at ASU for scaling up a saliva-based COVID-19 test that provides a large scale with rapid results. It's accurate, it's less invasive if you've had the other test with less PPE, and it gives us on-site rapid results that can be used at workplaces, businesses, healthcare facilities, you name it. In addition, testing in Arizona has doubled since the stay-at-home order was lifted, and it's up 600% since April 15th. That gives us more information, data, and allows us to make better real-time decisions. And with that, I'm going to turn it over to our Director of Health Services, the only person in the state who I think has been working harder than anyone, and I'm grateful. So take it away, Dr. Christ.
Thank you. Thank you, Governor. So the CDC this week released brand new guidance, and it's to encourage individuals to think about how risky, if they are going out into public, their activity that they're going to do. And so there's things that they want everyone to think about, because we don't want people who don't need to come into contact with COVID-19. We want everyone to take the precautions. But one of the key things that you want to think about is how many people are you going to interact with or come into close contact with, because viruses are mostly spread between people. So the more people you interact with, the more your risk is elevated. Being in a group of people who aren't socially or physically distancing or wearing a cloth face mask is also going to increase your risk. And engaging with new people that you may not have been exposed to is another risk factor. We do know that there is asymptomatic spread, so people may not look sick, they may not feel sick, and so that's why it's so important that everyone wear a cloth face covering when they are out. The other thing that you need to think about is, can you keep 6 feet of distance between you and other people, especially people that you are not close contacts with? Will you be outdoors or indoors? We always recommend that you stay 6 feet away from other individuals. The closer you are to people who may be infected, the greater your risk of getting COVID-19 is. You want to keep your distance from other people, especially if you're at higher risk. So if you have heart disease, lung disease, a chronic medical condition that lowers your immune system, or you're an older adult over the age of 65, you really want to take that into account as you're considering leaving your home. Indoor spaces, because of the ventilation and the circulation, are going to be riskier than being outdoors, where there's more air, there's more space to distance, and there's more ventilation. So being indoors is going to increase your risk, especially if you're clustered together. And then what's the length of time that you will be interacting with people? And so we know that if you're within 6 feet of another person for at least 10 minutes, that's considered the close contact. So you want to make sure that you are limiting that time that you are in close contact with other people that you may not be familiar with. Spending more time with people who may be infected is going to significantly increase your risk. As an update on the corrections, we are testing 1 facility per week. So because they are a 24/7 operation with multiple shifts, we have partnered with Sonora Quest. They are testing 3 collection sites 3 times a week for each facility. They started with Florence and are continuing to move on. We're also working with the Department of Corrections, Rehabilitation, and Reentry to test all inmates. So we will be partnering with some of our private lab partners to develop that timeline to make sure that we have the resources so that we can get those individuals tested. And our long-term care facilities, so we have completed the tests of the facilities that decided that they were not going to collect on their own. So we've tested almost 15,000 staff and residents, and we found that we had a PCR positivity of about 6.5% and a 5.6% antibody positivity. And so there's still 21 that are testing their staff and residents on their own. We also have tested the staff and residents at the Pioneer Home, as well as several of the ICF IIDs around the state. We're continuing to test additional ICF IIDs, and we're moving on to our assisted living centers. And we've gotten a lot of questions on the elective surgeries. So our licensing division is currently monitoring the facilities, what they are reporting on a daily basis to ensure that they are meeting the requirements that were set forth in the governor's executive order that allowed them to request an exemption from the executive order that stopped elective surgeries. So there's a few requirements that they have to meet ongoing. So they have to have adequate staffing and at least a 20% vacancy of beds. They need to maintain a greater than 14 days supply of PPE. They need to be testing patients and at-risk healthcare workers. They need to be doing universal symptom screens. This is actually a recommendation for all businesses, is to screen your employees. And then they have to have an enhanced cleaning process for the waiting rooms where those patients may come into contact.
Thank you very much, Dr. Christ. Let's talk about how Arizona will stay healthy going forward. We need every Arizonan to do their part, and I want to thank Arizonans for how much they've already done. This is about returning smarter, and we know that COVID-19 is widespread in our community. So vulnerable individuals, those that fall into that category of a certain age bracket with underlying health conditions, should limit their time away from home. In addition, physically distancing, cloth face coverings, washing your hands, and staying home when sick sound like such fundamentals, but they really are the biggest difference makers we can have to slow this spread and contain it. Also, an important part of containing this spread is the use of masks. The CDC first recommended this in April. We've built it into all of our guidance, and last week's study that was widely reported talks about the effectiveness of masks and real data, and brought more urgency to our expanding the use of them throughout the state. I've talked a lot about being on the other side of this pandemic in terms of knowing so much more than what we did on March 11th when we first issued the emergency order. So here's 3 things that we know. First, if you heard what Dr. Christ just said, you are most safe at home. If you can't stay home and you go out, you are most safe when you physically distance. And if you do go out, wear a mask. It's the smart thing to do. Now, we're monitoring areas of significant spread in our state. One is our southern border. 2 counties that cover Arizona's border with Mexico are experiencing very high rates of confirmed cases of COVID-19. This is both Santa Cruz County and Yuma. We're having ongoing conversations with local leaders, talking with Governor Claudia Pavlovich of Sonora, Nogales Mayor Garino, and I want to thank him for his thoughtful and persuasive communication, and the Arizona Border Counties Coalition. To give you an idea how different the situation is in different parts of our state, you can see a 31% positivity rate in Santa Cruz County and a 3% positivity rate in Yavapai, where Prescott is. So we've got a big state with different challenges and different geographies, and the situation is different in just about each place that you look. Now, on cloth face coverings, we've heard from local governments, and they've requested the ability to mandate masks. This is from Mayor Garino, who said, "We applaud your efforts to encourage people to follow the CDC guidelines, but we see that in our community, the message is simply not getting through. The rates of confirmed COVID-19 cases in our community are growing, and we don't see any sign of the curve flattening anytime soon. I'm asking you that you provide the necessary authorization for me to mandate the wearing of face coverings whenever our residents are in public or in situations when social distancing is not possible. This is an additional tool that additional mayors have asked for at the local level." Now, I've focused on a statewide approach where possible. Today, we're seeing facts on the ground and differing circumstances around the state support flexibility and a localized approach. Now, I want to be clear. We recommend that all Arizonans wear a face mask whenever you cannot socially distance, at the grocery store, at the pharmacy, at the bank, when you're on mass transits. We are going to change and update guidance so that local governments can implement mask and face covering policies and determine enforcement. Border counties are dealing with unique issues. This allows local leaders to tailor policies. In Arizona, we have our situation that is unique on our southern border. We have large metropolitan areas. We have rural areas and sparsely populated areas along with our urban areas. This will allow us to tailor guidance to address the spread with local, informed by local information. Now, in April, the CDC issued guidance recommending face masks as a voluntary public measure in public settings where social distancing is difficult to maintain. In April, Dr. Christ and I have shared this recommendation. In Arizona, my operations team has supplied 75,000 cloth face coverings to public employees, and I want to say thank you to the partnership with Brooklyn Bedding and Fabric in Tempe, FAB, RIC. Last week, we've seen studies supported by real data that speaks to the effectiveness of these face masks. Every Arizonan should wear a face mask. This is an issue of personal responsibility, and we're asking Arizonans to make responsible decisions to protect the most vulnerable in our communities. Arizona businesses also need to do their part. As we've reopened, there's been good actors. And I've said several times there's been outliers. By and large, Arizona businesses have been terrific. But there have been more than an outlier here and there. There have been some bad actors. I've chosen to focus on the good actors, trying to promote responsible decisions and good business management. But we need to address the folks that are not in line. So the Department of Health Services is updating its guidance. It will strengthen measures that will protect employees, customers, and patrons of these establishments. And if they don't, there will be enforcement, and they will be held accountable. We know most businesses are performing responsibly, and again, I thank you. I think you've done an incredible job. The requirements today will mirror the guidance provided to businesses upon reopening. For those that are operating responsibly, there won't be any change. It's going to be encouraging social distancing, 6 feet of distance between you and other customers, and limits on capacity when there's the option for a large congregation. The objective here, in addition to keeping Arizonans healthy, is to slow and contain the spread. Talk of containment is not something we've had a lot of opportunity to talk about because our rate of positivity has not been high. If there is any positive in the challenges that we face right now, it allows us to have more robust and effective contact tracing. This is to contain the spread, to provide the ability to rapidly trace contacts of cases and test those exposed to identify new cases. When we're doing this amount of testing on a daily basis and we get a positive case, it allows us to contact trace where that case may have happened. It's going to help to contain new infections and prevent and slow the transmission of coronavirus in our communities. This is included in the White House gating criteria guidelines as one of the core state preparedness activities. We are also going to call in the National Guard so that we can surge on this, with 300 guardsmen being called up to help with this. So if you do get contacted by public health, please answer the call. They have information for you about someone who has tested positive. If you have tested positive, stay home. Let me say that again. If you have tested positive, please stay home. And I know for me, I don't make decisions on anecdotal evidence. I go by public health and the data information that we have. But for months and months, I did not know anyone personally that had contracted COVID-19. Of course, I had heard from hundreds, if not thousands, of people that had contracted it and written letters and sent emails. But just recently, I know a lot of people that have contracted this. And I want to tell you where they contracted it. At graduation parties, at private gatherings in homes. Again, we don't want to see anybody get this, but we had graduations and parents have gathered. When this happens, it gives the opportunity to the individual that tests positive to participate in contact tracing. Basically to call everyone up that they were around, to let them know of the situation, has them getting a test, etc. So the contact tracing is done at the county level, with the state providing resources along with the National Guard, and we're going to surge in that capacity. We're also going to prioritize our high-risk settings. Part of what we've learned about this virus is it is highly contagious and very dangerous for those in the high-risk settings. Many of our most loved relationships, I've talked oftentimes about my grandmother, and I know there's other folks in the audience here who their mom or grandmother is in one of these facilities. So we're going to focus here, $10 million additional for masks and PPE to these facilities to contain and mitigate the spread, along with additional testing for residents and staff. The testing that we're able to bring online now also will allow us in time to figure out a healthier visitation policy for these facilities and the individuals inside them. And then, of course, we want to ensure hospital capacity. We know where we were in early March, and we know where we are today. We hope to not need this hospital capacity, but we will be prepared not only with what we have online right now, but if necessary, with surge capacity. So in summary, if you're to look at this plan of action, we're going to continue to boost testing, including rapid results testing. Again, thank you to Dr. Michael Crow and Arizona State University. We're going to amplify contact tracing in partnership with the counties, deploying the National Guard with additional dollars for counties around the state. We're also going to have increased awareness of distancing and face covering guidelines. There will be a public service campaign around it, supported with dollars, updated guidance from health services. We're going to empower local officials to provide additional requirements necessary for their geography, and this gives us the ability to target hotspots. We'll continue to focus on long-term care, and that will be ongoing. A $10 million additional investment in PPE and face masks, and enhanced guidance for establishments to limit congregations. This guidance will be issued by health services. We will give establishments the opportunity to be educated on what is proper guidance, but serious changes are needed to be made, and there will be enforcement around those changes. So I encourage all business owners, leaders, and entrepreneurs to review that guidance with great interest. And with that, I'm going to turn it over to Major General Mick McGuire and thank him again for the hard work of the women and men of the National Guard to give us an update on what is also happening around the Department of Emergency Management in Arizona.
Thanks, Governor. I wanted to quickly just recap the partnership that we have with Gila County, Pima County, and Coconino County as it pertains to my fellow emergency managers in those counties doing great things with Type 1 incident team led either by DFFM, the Arizona Department of Forestry and Fire Management, or U.S. Forest Service. Obviously, the biggest of those three events right now involves the bushfire out in Gila County. About 2,500 structures are in the evacuation zone right now, and Gila County has not yet asked for any additional assistance. We're really proud of the way they're doing things, and they have evacuation centers set up in Payson and Miami. We pray that they're able to keep those out of the fire out of the structural areas. Down south in Pima County, the Bighorn Fire, they did evacuate Summer Haven up there on the top of Mount Lemmon. They're doing very well, and I'm optimistic that they'll be able to keep that out if the weather cooperates and the winds stay down. Again, another great effort. And finally, the Mangum Fire up north. Great work done there by U.S. Forest Service on the north rim of the Grand Canyon, and evacuation shelter set up for those folks up in St. George, Utah, as it's the closest location. And we're continuing to partner with them if any resource requests come in. And we look forward to using, all of you have heard me talk about what we've been doing with COVID-19. We do have Task Force Logistics continuing to work on the food supply and sustainment mission. Task Force Aviation has been, had folks pivot to do wildland fire response as well as what we did for the Navajo Nation. Our Task Force Med Group will be added, as you mentioned, 300 more. They'll be task organized by 15 county teams to be deployed to all the 15 county health directors to do the contact tracing to hopefully slow the spread and help those most vulnerable in our population so they can get back to normal. Thanks.
Thank you very much, General. So if you remember one thing from today's press conference, it is that COVID-19 is widespread in the state of Arizona, and Arizonans must act responsibly to protect one another. And with that, Patrick, let's take some questions.
Hi, Governor. The two basic questions. Last week when I asked you about face masks, you sort of poo-pooed it, said, hey, I got one in my pocket when I go to Walgreens today. You walked in with a face mask, as did your health director. There's hand sanitizer on the table. There's a napkin to put it on. What changed in the last 6 days to make you go from, I'm not going to mandate it, I don't believe in local options on this, to this?
So, Howie, you're putting words in my mouth, and you're also reading my mind.
That's why I'm asking.
What I talked about was the importance of masks. Masks has been in our guidance since the Center for Disease Control put that forward in April. I've talked about masks. Dr. Christ has talked about masks. I said I am in favor of masks. If your perception was that I was poo-pooing it, that was not the case. I was pointing out that I have a mask and I wear it when I cannot physically distance. We want to see all Arizonans wear masks, and we are going to be working with local leaders so that we can have that flexibility. And yes, I do, I've said a number of times, I'm grateful to the White House for the flexibility in the gating criteria. And there have been over 100 days where we have been able to make statewide directives that would improve the condition in the state, it would slow the spread, it would reduce confusion and complication in the state. On this issue, we needed more flexibility. And the flexibility is going to be given to the mayors. I want to thank the mayors for their input, for us understanding their situation, a unique situation like what's going on in the town of Nogales, which is much different than what's going on in rural Arizona.
But that's exactly the question. When I asked you last week, and I'll go back and I'll look at the transcript, Governor, you've often said the government closest to the people is best. And you said, I believe that, dash, except in cases of pandemic. Something changed in the last 6 days to cause you to conclude that a statewide mandate is no longer appropriate.
Well, the first thing I would say is there will be other decisions that have to be made over the course of this public health crisis. Some of them may lend themselves to a statewide directive. This one lent itself to the local directive because of how different it is in so many different parts of our state. You know, a directive or a mandate is only as good as the compliance that you have. The local leader, the mayor, the county supervisor has a much better read on what is happening in that county and what the actual guidelines should be for whatever the directive is around face coverings. And like I said, I want to see all Arizonans wearing a face covering.
Real quick, just real quick, will they be able to have penalties? I noticed the letter from the county officials said we weren't going to impose them. Will counties and cities be able to impose penalties for failure to comply under your? This is going to be up to the mayor, up to the mayors and county supervisors. What we want to see, of course, is we want to slow the spread. We want to contain it. We want to bend those numbers in a downward trajectory. So education is part of this. And along with that is whatever compliance is necessary.
Jeremy and then Melissa.
Governor, it seemed highly likely once the stay-at-home order was lifted that there would be more spread of COVID from people going out and starting to resume some of their regular activities. Why not implement some of this stuff at the very beginning so it was less necessary now?
Well, I want to say we look at the data in terms of what our decisions are. We want to make the best possible decision given the information and facts that we have in real time. We haven't guessed, we haven't speculated on what was happening. We've had some successes in the state of Arizona. We've seen where we've gone around the stay-at-home order, where our positivity rate was. There was an expectation that would increase. What we're seeing today concerns us, and that's why we're adjusting.
But should there not have been more enforcement of some of these guidelines that you ask businesses and people to abide by once the stay-at-home order lifted, like from the very beginning?
I imagine in a setting like this that hindsight's always going to be 20/20. We're going to make the best possible decision we can every day, informed by public health and Arizona's numbers.
Come on down.
Good afternoon. Governor, I just was hoping that you could be very specific on what cities and counties can determine as far as their flexibility. Is it masks? Is it restaurant capacity? Is it public parks? Is it what the...
It's masks. The focus here is around face coverings and masks. Wearing a mask is a good idea. I encourage every Arizonan to wear a mask. In some of our situations, some of our towns, there is an increased need for these masks. That will be left to the mayors.
So just masks?
On masks, on face coverings.
And could you get a ticket?
Well, that will be a question for the mayors. Like I said, we are focusing on education, on protecting public health, on making certain that people stay healthy. We're not focused on writing tickets or enforcement. But when you do put a mandate out there, what's important is the maximum possible level of compliance and, where necessary and needed, enforcement.
Thank you.
Governor, I'm trying to understand what went into this idea of allowing different municipalities and counties to come up with their own rules when it comes to masks. This pandemic doesn't stop at the border between Tempe and Chandler or Phoenix. Why not impose a statewide mandate for people to wear masks when they are indoors in a public space?
So part of the reason, one was just listening to our mayors, talking with my team, my public health team as well, is how do we solve this issue? On some things, a statewide directive or executive order works very well. On other things, if you do this and you don't have maximum compliance, if you look in parts of our state, especially rural Arizona in many of these places, there's very little transmission. So if you do something like this and you have, I'm making up numbers here, but if you have 12 or 13 counties that say pound sand on an executive order because that doesn't reflect our situation, it's a self-defeating executive order. So we looked around, like I said, Arizona was not hit first. We have learned a lot from what has happened in other places. We've been able to observe what other states have done to slow the spread, to protect people, and to provide that flexibility. And this was one that, answered a request of mayors, but also is the best way so it can be tailored, because it likely will be different, and I'm not going to write the order for Mayor Guarino. That's up to him, but it will likely be dramatically different in Nogales than it is in Prescott.
Governor, as you know, President Trump is coming to town, and he's going to be attracting thousands at his rally. Have you been in touch with the church to figure out how to do this logistically and just what is being done? We're going to have thousands in one place. How does this comport with the problems that we have now, and what are you going to do about it?
So my understanding is from what's happening in other parts of the country that are scheduled before us is that there's a protocol around hand sanitizers, masks being handed out, and temperature checks. What we know in terms of transmission is outdoors is preferable to indoors. This can be difficult in Arizona in the summertime, especially in the valley. If that's not possible, facilities with the best possible ventilation makes the largest difference.
But we know now that this is airborne, and social distancing, I'm sure, is going to be a problem. How do we deal with those issues?
These are voluntary events, and people will voluntarily make the decision.
Is that good enough for you? You know, to leave it up to them what to do?
We're going to protect people's rights to assemble in an election year.
We're going to go to the Zoom board next, and we're going to speak with Kathy Ritchie from KJZZ. Kathy, go ahead.
Can you hear me okay?
Yes.
Hi, Governor. Hi, Dr. Christ. I do have a question about long-term care. We're going on about 3 months since families have been allowed into these facilities to visit their families, and I'm hearing stories that these individuals are deteriorating because of the isolation. I'm wondering, what plans are you working on to allow families in and ombudsmen? Really, families are the eyes and ears, and they haven't been allowed in. And as you know, Governor, your grandmother's is a resident at a long-term care facility, so I'm sure you can appreciate the stress some of these families feel.
Yes. Yes, thank you, Kathy. Dr. Chris, do you want to address our plan, and I'll talk about some other things that we have on the horizon.
Sure. Thank you, Governor. With long-term care facilities, we have been very, very careful to protect this vulnerable population. Probably one of the hardest things I hear are the people who they can't go see their loved ones. And so this is a very, very difficult situation, we know, both for the residents and their families. We are looking at ways to expand visitation when it is safe. We were hoping to be able to do that, but given the current data, we are holding off on implementing any visitation right now. But it is one of the most important things for us. And the ombudsman should be able to go visit. My team has received that information and is getting that messaging out to our long-term care facilities to allow ombudsmen in the facility.
So Kathy, that is a focus of ours. I think it's incredibly important. Again, learnings from other states that were hit before us. When you can meet a loved one outside, physically distanced, with a mask is a safe way to do this. Again, it can be challenging in the valley in the summertime. Rapid results testing is another way that we can do it. We want to focus on the challenge that's in front of us right now, but we want you to know that that is a top priority for myself and my team.
Okay, I have a question for each of you. Dr. Christ, as a medical doctor, you have a sworn oath to do no harm and prevent versus treat whenever possible. More people are still going to the hospital. Therefore, why has Arizona's posture not been reflective of stronger mitigation efforts for over a month that would reduce the number of people seeking medical attention and a stronger stance on mandating preventative measures? Is there more guidance that the governor needs to hear from you, since you're our top expert?
We've been working very closely together to implement the mitigation strategies, and hopefully today you see we're strengthening them. So we will be revising the guidelines. They now will be requirements for restaurants and businesses to enforce physical distancing, to ensure that there are safeguards in place to prevent transmission. And then just making sure we get the word out that there are steps people can take, because we don't want anyone to get this virus.
It's taken quite a while to get to this point. I mean, all eyes are on you as the doctor.
Well, and we did put in the stay-at-home order in place. That was to give our hospitals time to build the capacity that we had anticipated we might need on a worst-case scenario. We are monitoring very closely with our hospitals.
Risk level right now inside the hospitals, if you could be honest with us, as far as is it 20%, 50%, 60%? What is really happening right now inside of there for the risk?
I think that our hospitals, they are not in a crisis standards of care mode. I think that our hospitals provide excellent care here in the Valley, and I would trust them to provide.
So zero?
I don't know that you can give any kind of risk. I mean, people are sick.
Governor, can I ask him about enforcement really quick?
Governor, you said that you've left it up to cities to do their own enforcements on masks, on restaurants, and I would assume large gatherings after that. And if you're not giving any guidance on enforcements, would you say that maybe the next step after that, if no enforcements are being done and if the disease continues to spread, that the next step could be to shut down the state again?
So, Peter, thank you for the question. The objective here is to be effective, to put forward initiatives, guidelines, and ideas that will have a result. And what we're going to be measuring is number of cases, percentage positivity, and how we contain this virus in terms of contact tracing. These measures, in terms of breaking up large gatherings, increasing physical distancing, have worked in the past, and we have every confidence that properly implemented, they will work going forward.
And you hope not to return to a shutdown order?
This is our plan. Like I said, we're gonna be shoulder to the wheel. We're going to be partnering with local communities and with Arizonans. Arizonans are a common sense people that live in a pretty extreme environment at different parts of the year, and they've made good decisions to this point. With the information that we have today and the partnership that we'll have with local leadership, I'm confident we can change the direction and be where we need to be.
We're going to go to the Zoom board next. Ryan Randazzo from the Arizona Republic. Ryan, go ahead.
Hi, thanks, Governor. As you're aware, the additional $600 a week that Congress approved in unemployment benefits is going to expire next month. We've got a few 100,000 Arizonans surviving off of those benefits today. I wondered if you could share your thoughts on either increasing the state maximum benefit or increasing the eligibility for people in this state, and any other conversations, and whether you might do that through executive action or if you've had any conversations with the legislature.
Thank you, Ryan. I mean, part of what we've focused on this entire time, and even before COVID-19 ever hit, were the tough decisions that we needed to make in Arizona to balance our budget, to make sure that when the social safety net was stretched, that we had the dollars available. We're grateful to the federal government for strengthening that social safety net. We are having conversations with the administration on what the future can look like, and really our focus has been 100% around COVID-19 and the public health crisis, but also balancing the operation of the state and returning Arizonans smarter and stronger into our economic activities.
Thank you. Question for the governor and then Dr. Christ. Governor, will you be redistributing the CARES Act money so small cities and counties get an equal share that Mesa, Phoenix, and Tucson got?
We used the guidance and equation from the Department of Treasury when we met with local mayors, and it was every municipality outside of the largest municipalities. So I think Phoenix, Tucson, Mesa, Maricopa County, and Pima County all received federal CARES dollars. We allocated to cities and towns on the Treasury formula, and we have additional needs for those dollars, including circling back to what Ryan talked about, unemployment insurance funds, along with dollars with K-12 education.
The federal formula was to use the same formula that applied to the big cities. So why wasn't that formula used?
It was left to the discretion of the governor.
So why did you not use it?
Because we have additional needs for those dollars.
Okay. Dr. Christ, question about elective surgeries. There's an 80% threshold for capacity. ICUs are at 83% today statewide, 85% for patient beds. Surely some hospitals are going over the limit. Have you retracted any support for hospitals doing elective surgeries, individual hospitals, or is it time to look at all hospitals?
So we are reviewing all hospitals and the data that they're reporting. As with our licensing standards, we always give them the opportunity to come into compliance or show us where we might have incorrect data. So we will be working with them as we move forward, but we will be working on, some have applied as a whole system, some have applied as individual hospitals.
Are any out
So
of
we need to
compliance
take
right
that.
now?
We've got hospitals that we do know are over the 80%. A 1 day over or a couple days over wouldn't necessarily throw them out if they were taking steps to get back under that. So we need to talk to our hospital
And
partners.
lastly, DHS, how will you enforce the business piece of the governor's new order?
So the enforcement can fall to DHS. It can also fall to local law enforcement or the regulatory entity that oversees them. So while they may not all fall under DHS's purview, DHS is making the recommendations.
We're going to go back to the Zoom board. We're going to go to Vaughn Hilliard. Vaughn, go ahead.
Thank you all. Two questions here. This order, is this specifically just for masks, or are you considering an order in which would also allow other operations, whether it be casinos or water parks or restaurants, retail? Is that under consideration at all? And more broadly, and I ask this question not to make us look back, but more with the acknowledgement that there is a likely second wave on its way, and other states are also trying to learn from what this state has gone through. From your evaluation, what did go wrong in the last month here in the state? Thank you.
So the first thing I would say is the executive order that was put forward is to address masks, but it addresses more than that. But it's more to the business owner and operations in terms of the physical distancing and breaking up of large congregations. In terms of Arizona and where we are, like I said, we have had some success through this in terms of our preparation in anticipation for what would be our challenging time. The information that I've been advised on was that our first wave would be later, and it would be in the June, July, or August timeframe. And that's where we are, and that's the decisions we're making to address.
Governor, good afternoon. So we've all, for the last several months, been looking at the daily numbers come through. It started at a few cases a day, then a few dozen a day, then a few hundred a day. We're up to a couple thousand a day. When you reopened the state a month ago, we met all 6 opening guidelines, barely in a couple cases, but we did meet them all. We're failing 4 out of the 6 as we stand here today. That seems to be I hate to say it, but you're the man who made the call. Do you take responsibility for making mistakes in how you reopened, in not putting better systems in place to prevent this surge we've seen in the last month, which has been pretty big?
So you're right. When Arizona did make the decision to reopen, we were at that time squarely and safely in phase 1 by symptoms, by cases, by hospital capacity and testing. We're going to continue to surge our testing. We are making some adjustments. The things that allowed us to get in that situation was first the idea that we were breaking up the larger congregations that were happening. So we're going to make the proper adjustments so that we can have successful results going forward. No one knows what the future holds with this virus. No one knows what's going to be brought in the fall. I was just told by a member of my staff that a renowned epidemiologist was commenting that possibly in Arizona has some inverse effects around our flu season because we're indoors in the summer. It could be any one of these issues. We've seen problems over the course of the last several months. We've addressed each one in its turn. We've been successful to date, and I'm confident with the commitment of Arizonans and responsible business owners, with guidance from public health, we'll be successful going forward. But there is work to do today.
Do you think you made any mistakes?
Oh, I'm sure I made.
So how do we
You guys
get
like
here?
to write about them all the time.
How did we get here? We're at, more than 40,000 cases, almost 2,000 cases on average a day. When you reopened, we were at a few hundred a day.
Well, there has been a 600% increase in testing since April 15th. Testing has doubled since the stay-at-home order. That, in addition to an increase in positivity, naturally results in increased cases. I want to remind everyone that the focus the entire time was that we would be prepared come what may in a pandemic. We've not seen a worst-case scenario. We're prepared today but want to avoid it. And that means we want to keep people healthy, we want to slow the spread and contain it through contact tracing.
We're going to go, if I recall correctly, last week, just changing tracks, you said that you wanted a public process to deal with the Confederate monument and the plaza. What's that going to look like? Where does that stand now? Who's part of that public process? How do we participate?
So I think in response to the question on memorials or monuments that are in public areas, there was a public process for them to happen. If there's going to be a change, there should be a public process around that. That's something that we're going to have to work with legislative leadership on, or the legislature, or some type of guidance. But there should be a public process. It shouldn't be left to one individual.
Governor, the fact is that you signed a bill taking it away from the Mall Commission, the public process, and gave it to Andy Tobin.
And there should be a public process, so this is something we will address.
So when are you going to have this? Are you, I mean, look, I know there's sometimes a belief among politicians that if you sort of ignore it long enough, it'll go away. When the iron seems to be...
My focus right now is public health.
We're going to take one more question here. We're going to go to Melissa Egan from KOLD down in Tucson. Melissa, go ahead. Melissa, you may need to unmute your Zoom mic there. Okay, if we're having trouble with... Yes, we're going to go to some people having a question. We're going to go to Cassie Tafoya from Globe Paper, AT Silverbell. Cassie from Globe, go ahead.
Hi, can you hear me?
Yes.
All right, so Cassie Tafoya with Arizona Silverbell, and I have a question regarding the hospitalizations of these increased cases. Is there somewhere we can get background data as to not how many have the virus, but how many are being hospitalized by the virus?
You can find information about the hospitalizations, both the self-reported metrics by the hospitals as well as the hospitalizations that are identified through case investigation at azhealth.gov. And you can click on the data dashboard, and there is a separate page for hospitalizations.
We're going to last question here from Telemundo. Go ahead.
The question is regarding the prisons in Arizona. Specifically, how many cases have we seen rising there? How are you guys mitigating besides just the testing and possible isolation? I mean, a lot of people are still concerned that their family members in the jails or the prisons are getting infected, but they're not coming out. So what are you guys doing in that regard?
So this is a real focus of ours. Wherever there is congregate care, whether it's a long-term care facility inside our prisons or our jails, is something that we want to focus on. I'm going to let Dr. Christ share the statistics with you, but the objective is that we use testing to make sure that we can care for whoever is sick, and cohort them away from the general population with rapid results testing. We'll be able to do more of that. We'll also be able to make certain that vendors, correctional officers, and visitors are virus-free before they visit. And the idea, of course, is just like the rest of Arizona, we want to protect and provide as much positive options around public health.
Sure. So the Department of Corrections does post on their website a dashboard of the number of cases and the number of tests that they are doing. We work very closely with the Department of Corrections when they do have a case to implement contact tracing so that they can identify individuals that came into close contact with them. Those cases, positive cases, are put into isolation where they are isolated medically with other COVID patients if necessary, to keep them out of the general population, and then the population is monitored for symptoms over the next 14 days. We are working with them to get the inmates tested, like we said, and we're working with them to implement infection control. We have gone through their infection control practices with each of the facilities, and we are going on site to make sure that they are being implemented on site.
Do you have any of them be treated at like a hospital type scenario right now?
So the Department of Corrections, depending on what facility it is, they can treat on-site. Some may require hospitalized care off-site, out of the prison facility.
Governor, a new ASU report from researchers with the modeling team, and I think some of Dr. Christ's team, said that Arizona never met the CDC gating criteria to get to phase 1. Who's lying, you or them?
I guess different people can look at data in different ways. I'm being guided by public health and the Centers for Disease Control. So let me close by saying that, one, thank you again for the responsible behavior and common sense of Arizonans. I'm incredibly grateful. There was a question today around mistakes. What I want to tell everyone is we're making every decision with the best information that we have to protect the public health of Arizonans throughout our state. We have shown urgency. We're going to show additional flexibility, and we'll continue to do that. This is a challenge right now. COVID-19 is widespread in Arizona. I'm asking Arizonans to behave responsibly so they can protect each other, protect the most vulnerable, and follow that focus of physically distancing, of washing your hands, of staying home if you're sick, and wearing a face mask. It's good for you. Thank you very much.
Thank you.
I know, right?
I think there's some